A very good morning to all of you, and I welcome you all to the 39th episode of the DAMS Transform series, which we do every day at 10 a.m. I am Dr. Sumer. With me, I have Dr. Deepti, and our duty in the morning is to pep you up, wake you up, and make sure that you have a very productive day.
Yes, a very good morning to all our dear students, and I hope everybody is doing good. So, yes, today we have a very important topic to talk about, and something which is especially bothering a lot of students right now. In many ways, it is something that does bother people off and on, right? And that is how to keep your focus amidst the distractions, how to ensure that you are still focused despite whatever the circumstances are.
So, first of all, the question that I want you all to answer is, and that's very important for each one of us, that we all talk about focus and we all talk about discipline, distractions. And my first thing is, and I talk about this a lot in my entire of my organization also, it is not about an individual's willpower. It is about a system that you develop. I'll give you an idea. Like, suppose you want to have a lot of willpower to go to your app and do the dams question bank and do a question. But if you build a system, I'll tell you the system example of a system is, and we do it for ourselves also. I'll tell you our example also. So at 9:45 or maybe at 7:45, you will have a coffee, some breakfast, and at 8 o'clock to 9 o'clock every day you will do MCQ. So that becomes a system anchored around a habit that you already have. It not necessarily coffee, it could be tea also. And I don't want to get into the tea versus coffee debate in the our country right now, but the idea is that whatever time you wake up, and I know for sure that most of us, in especially in the our culture, we need something to wake up. It could be a tea or a coffee. So can you anchor one habit that as soon as I will have a coffee, side by side, when my coffee is halfway through, I need to make a habit of putting on the app, logging in, starting the MCU, so that by the time my coffee is over, I do my first step. And so it is not about willpower, it is about systems.
Yes.
Even in business, I keep talking about this, that we need systems in place. We don't need a personal genius, we need systems in place. Even in for our personal health, and or Deepti would agree, whenever we have to go to a gym, we have to anchor that habit to something that we are already doing. So like for example, if we go to drop our kid, we know that okay, on the way back, instead of coming home, we can go to the gym. So it's like you anchor the thing that you want to do and build a habit, build a system, rather than thinking that one day your willpower will be so strong that you will beat the world's distraction. The distractions are always smarter than us.
Yes, absolutely. And if I just put it how what Dr. Sumer is trying to say is, number one, the first thing that we could all try, is create a mental boundary, right? So you all understand our brain works on signals. You have to feed it the right signal. So what Dr. Sumer is trying to say is that every morning or whenever you want to sit and study, your brain has to receive a signal. Okay, this is the time to study. And one of the ways of doing it is, what Dr. Sumay said, have a coffee, and by the time you finish it, you have to sit and study. There could be other ways of.
Whatever habit you have,
Yes.
anchor the study to that habit.
And you know what all things I could also do? I would also say go and sit in the same place, right?
Yes.
Instead of saying, okay, we are going there, here, one corner, other corner. No. Make a common place so that the moment you enter that space, the brain knows, okay, this is my study area, right? That's where the concept of study tables came. Okay, use the same pen, use the same copy, right? For example, the moment you're in front of that copy, the same pen, these are all like passive signals telling your brain it's time to study, and it really works. So a dedicated area, okay, and I want that area to be walled off, cornered off as well. Even something like, let's say if you don't have an extra room, that's okay, but something like a little curtain can also work, right? So if you do that, it tells you that you are cornered off from other things. You are in a place which is your study area, right? So these are the signals we want you to feed your brain so that it realizes that it's time to study. Yes.
So the message number one is create a zone where this is the zone where I study, and create a schedule or a rhythm or a habit or a system which you follow every single day. One day randomly you wake up and you do 500 MCQs and you say Dunya Fateh kar li, and then next 7 days you do nothing about it. It's not going to work out. System means I'm doing 50 every day, but that every day means every day. Like, for example, now you can also notice a pattern now that we are following a system with you. Every day 10 a.m. daily
Yes.
transfer series, we are talking about your studies. अदरवाइज 10 बजे हो सकता है तो किसी से बात करता क्या करता तेरा हर दिन 10 बजे एक सिस्टम बना दिया मैंने कि वी आर गोइंग टू टॉक अबाउट योर स्टडीज. The second thing is, now the first thing is system. Second is you have to find your distractors. You have to find your distractors. Like, for example, and I'm sure many of you will agree, if I ask you to type in the comment box, what is your number one distractor? I already know the answer, but for you to know, I just want you to type it there. What is your number one distractor? We all say TV, but I feel TV is no longer the major distractor. It
Yeah.
is it is the device on which you're watching us right now. It is your phone. The phone with notifications and constantly telling you something or the other is there. So the settings on your phone are also one of the most important skills that we need to develop. You need to know which apps you want notifications on, which are the clutter apps on your phone which you need to remove. You also need to build a time where you put your phone on a airplane mode and you focus at that time on study. So we can talk about things like Pomodoro technique, that during the Pomodoro the phone goes on the airplane. The world will not change by your putting your phone on the airplane mode. People will decide whatever they have to decide based on the circumstances they are in. They are not going to ask for your advice. So please put your phone on the airplane mode for 45 minutes and study. You would have a good time at it. But the only thing is, I want you to remember, whenever you are studying, put the alarm on I'll show you also. Take a simple clock like this and put the alarm of 45 minutes on this clock rather than on your phone. नहीं तो क्या होता है ना कि आज 15 मिनट बाद फोन उठा के देंगे यार 45 मिनट्स नहीं हुए क्या टाइम नहीं हुआ क्या एंड द फोन कम्स बैक टू योर हैंड अगेन सो यू हैव टू डू दिस remove one thing. So number one was system. Number two is you need to have a place where there is no distractors. I will add one personal thing from my side, and I'll ask Deepti for her distractors also. For me, noise is a very big distractor. If I'm trying to work and I'm trying to do something, the noise is very big distractor. So it is sometimes I find those things which are making noise, like cranky fans or something making a noise would always take my focus away. If it still doesn't work out, having those noise cancelling headphones will also help you to find a zone where there is no distraction. So let me ask Deepti what are her distractions as well. But for me, these are the top two: phone and noise.
Now, the third thing that I would say is a lot of times students say, Ma'am, TK, we have switched off the phone, we are sitting in a room, but what do I do with my thoughts? Right? So tell me, how many of you have wandering thoughts? Right? And they could be wandering anywhere. They could be about what will happen with the current situation, what will happen on some other issue that's going on, what will happen in the house if there is some issue in the house. Yes, so a lot of times it's not the external sources, a lot of times it is your thoughts. Yes, so they keep coming back to you and they keep distracting you. Yes, so now what do? We've turned off the phone, we are sitting in a room, but what do I do with my brain? Yes, so now I'm going to try and tell you something that even I practice whenever I feel my thoughts are getting distracted. Okay, the first thing I want you to know that you have to snap back. So how do you do that? So when you understand or realize that your mind is wandering, can you do a count back from 5? Yes, that's called as the 5-second rule. So whenever you're
It's
distracted, try this:
five,
5, 4, 3, 2, 1. Okay, get back. Okay, you need to snap back. Try it out. It does work. Okay, try it out. This is called as the 5-second rule. It's not only for anger management. People usually use it for anger management because we don't want to give an immediate response. So we want to sit back, think, and then only reply, okay, so that we are not abusive, we know what we are talking about, we've calmed ourselves, and we are able to think more practically. But the same rule, the 5 second rule, can also be applied for distractions, especially if it's coming from your own mind. Okay. Third thing, when you're too worried about something, right? So these are like random thoughts. LOC पे क्या चल रहा है, अभी किसी और ने क्या ट्यूट, ये तो random thoughts हो गए. So इनके लिए 5 second rule usually works. What if you are also affected by something which is a fear for you, right? आपको डर लग रहा है, maybe something in the family, some circumstance, something, then what do? So what I practice at this time is a meditation, and my form of meditation is saying a prayer, right? I have my set of artis, right, that I will definitely do. Maybe it could be a Hanuman Chalisa, it could be whatever, but something. So it just takes me 5-10 minutes to finish my artis, and I feel that they have a very calming effect, especially if it is fear which is affecting you, right? So try these two things. One I will say is 5 second rule. This is for random distractions and random thoughts that keep coming to your mind, and you feel like, you want to look at things. But if it is a fear of something that is worrying you, then meditation helps. So take 10 minutes, do some form of meditation. It could be anything. For me, it is arti. For you, it could be music. Okay, it could be anything. But
Yeah, like
this,
for example, I'll add a line here. Sometimes when I used to study in my school days, college days, we used to have that Walkman, and in between we would play some music. Nowadays, you have so many things on your phone and even your watches. But at that time, we had that Walkman which you would put on your belt and put some music on. And also, I wanted to add a line about visual reminders. Visual reminders means that whenever you are studying, you are getting distracted and you're thinking about A, B, C, D, E, F things, but you need to think about your study. So wherever you are sitting, right in front of your desk, you should have a thumbprint board, and on that board you should put some visual reminders like checklist. This is what I need to achieve this week. This is my long-term plan. So as soon as your mind is wavering, your eyes will start wavering. You look up and you find that visual reminder. मुझे बड़ा डॉक्टर बनना है. And then the visual reminder, इस हफ्ते मेरे ये टास्क हैं, मुझे डैम्स का जीटी देना है, मुझे मॉक टेस्ट देना है, मुझे ये देना है, सीबीटी के लिए रजिस्टर करना है, भूलना नहीं है, डेट निकल जाएगी. And I'll put those check marks there. So visual reminders of your micro level targets and your big dreams is always works. So if you don't have those, it's a good idea to add them, because when your mind is wavering, but then your visual cortex sees a visual reminder, and it triggers the stopping of those thoughts.
okay, so the next thing is that something that I always keep talking is well-defined targets, right? I always say study with well-defined targets. But now I'm going to elaborate a little more, which will also again help you come off the distractions. And that is, when you have a well-defined target, break it into smaller chunks. Let's say currently I am studying physiology, but I'm getting very distracted. So what I will tell myself is, okay, in next 10 minutes, I will solve 4 MCQs. It's just 10 minutes and it's just 4 MCQs. But it helps me shift my focus from a distracting thing to something which is more aligned to my cause, right? So जब आपका ध्यान भटक रहा हो, there are various ways how to get it back. We have to, it's a learned behavior. Our brain is very sharp, it learns, okay? So do these various things, and most of the time, something or the other will work for you. Different things work for different people. But yes, whenever my son is not ready to study, I'll say, okay, come to me, we will just do this in the next 15 minutes. Now he says, acha, sirf 15 minute ki to baat hai, let me do it, right? So give yourself very short targets only to bring your focus back, okay?
And also, I would also include a new element for you, which some of you, when you are studying solo, you may not have that idea with you, called as accountability. You need to have someone to whom you are accountable for your progress. Like, for example, if you see, this is a very common term in gyms called the gym buddies, where you are telling each other, boss, तूने कल इतना weight उठाया था, आज इतना उठानी. You're accountable to each other. Similarly, there's something called study buddies, where you have a friend, and that's very important. Study buddy doesn't mean somebody who's pulling you down. Then block them. someone to whom you can just tell that boss आज मैं रोज 50 क्वेश्चन करता था, आज मैंने 60 किए, और वो बोले अगली बार 70 करने हैं, like that. So you need an accountability partner. But if you don't have it in your friends, which is possible in medical scenario, you could have a study buddy in your mother or your papa. And we are here to help you with this also. That if you want to tell us something every day in the morning, just log on to the transform and put it in the comment box. Yes, sir,
Not
madam,
just
मैंने ये किया,
this.
मैंने ये किया.
Yes. Not just this. Please go to my Telegram channel. Every day morning, I give targets and I say, tell me your score. Because I want you to be accountable. कि मैम आपने कहा था मैंने किया है, right? So please, and आज भी I've given you targets of 5 tests which are free for everyone. Everyone must try and finish whatever is pending from those 5 tests. There are 3 tests from INICET Predictor Series, and there are 2 tests from Transform 10x, which are again INICET based ECG and surgical classification test. So 5 टेस्ट का टारगेट है, जितने भी उसमें से पेंडिंग, एंड दे आर जस्ट टेस्ट ऑफ 2020 MCQs, दे आर मिनी टेस्ट. सो अगर आपने ये 5 टेस्ट भी कर लिए, यू आर लाइक सॉर्टेड फॉर 100 MCQs फॉर द डे. इट्स मोर देन इनफ, right? Then I will only focus on what I have done wrong. So we are giving you targets. You need to give yourself targets and you need to have accountability कि मैंने किया है. आप खुद को बताओ. If that doesn't work, tell your parents. If that doesn't work, tell your teachers, right? So you have to see. It's very simple. We have to do things which we feel will make a difference in our performance. And that is what you have to think. Okay, whenever I am in a problem, or I'm not fulfilling my targets, I know I have to discuss with Dr. Sumer. He will probe me, he will push me, and I will be realigned. So similarly, each one of you have to find out how to be accountable and to whom to be accountable, and then just follow the path. Okay.
And next, I will try to include one more thing in the discussion before we start taking some of your queries for the day. And this will go against me at my home, but I want you to know. So there's something called as decluttering of the space. Now, when you start studying, I know Deepti is already out, and maybe it's not going to be a good idea for
Yes,
me.
because I'm going to laugh otherwise.
Wherever you're studying, you need to declutter your space. Like, for example, right now, you just look at this desk on which you're studying. You will find umpteen number of notes and material that you might have collected, X, Y, Z, PDF printouts, which you are actually not using and you're never going to use them again. Just remove them from your table. Put only your LRR, your DAMS Live Rapid Revision notes, and your DVD book. So this tells you clearly this is what I need to do in the coming 2-3 weeks, 4 weeks. Just put those only the things that you require on your table. Declutter everything. Keep the clean pieces of paper, a pen, and your table is reflective of your mind process. And Dr. Deepti is already smiling, and I think I might have to clean my room after this. But I had to tell you all.
No, but this is really true because I know with kids this is true. When I sit with my son, if there is a water bottle on the table also, after every 2 minutes he wants to drink water, which is not really he's thirsty, he's distracting himself. If there is a pen stand, he's using one pen, but he'll keep going back to the other pens in that pen stand. So limit your access, right? That's how you stay focused. Limit your access. The things around you, they're all going to distract you some way or the other. So you limit your access to improve your focus. Okay.
Okay, now let's take a few queries very fast. One bacha is saying, sir, I'm a FMG. I'm enrolled with you in the DFX program for the FMG revision. I also targeting UPSC exam. Will it help? Definitely. DFX is an excellent course. DFX is the gold standard revision course for the foreign medical graduate exams. And also it helps in the UPSC also because UPSC has a lot of clinical predominance in the paper, which we anyhow give a lot of time in DFX. So don't worry about that. So Dr. Tripathi, I hope I have answered your query. एक बच्चे ने पूछा संजय ने कि सर अभी इंटर्नशिप चालू है 3 महीने हुए हैं पर समझ ही नहीं आ रहा रिवीजन करूं कैसे सारे सब्जेक्ट पे जीडी. देखो संजय प्रॉब्ली आप अभी रिवीजन की जगह ना पहली रीडिंग के बारे में तो सोचो ना, एक बार समझने की कोशिश करते हैं. एंड आई डिड अ बिग वीडियो अ फ्यू डेज बैक ऑन दिस. व्हाट शुड बी योर डेली रूटीन इन इंटर्नशिप. अभी इंटर्नशिप अगर आपका शुरू हुआ है तो probably you are targeting the 2026 NEET PG. There is a separate video on the Transform series about 2026. Start your day with 50 MCQs from DQB. Then evening should be a 5-hour time on theory. which will be either a ultimate live class. If you are a highly motivated student, use the back to basics
Back
video
to
class
basics.
to yourself. If you have already studied, do the theory from your previous notes and then target TND for that week. So 5 hours for theory, 1 hour in the morning for the MCQ plus internship. Rest of the time you will spend on internship. Then it will you will add on the off days your tests and grand test every month. 3 class tests of the subjects that you're reading and 1 grand test. This should be the rhythm that you need to build up. If you have time, please see, this is a video, I think 2 3 days back only I did it on the Tabs YouTube channel.
Okay, I will answer two queries. I think Devanshi had asked this query earlier as well. Ma'am, should I study one subject per day or two to three? Devanshi, I would definitely recommend doing at least two subjects in a day. Doing one subject makes it very monotonous and very heavy on the brain as well, right? So it is a good idea to combine one major and one minor subject, or combine integrated subjects. For example, if you're doing surgery GIT, it's a good idea to go and revise anatomy GIT at the same time, or blood supply, or whatever. If you're doing gynae, it's a good idea to go and revise embryology, right? So it should be at least two subjects, and also not more than three. The upper limit is three. Maybe morning one subject, afternoon another, and evening third subject, but not more than that, because then it will not give you a feeling of finishing anything. You're doing everything or something about everything, but nothing is finishing, right? So it's important to finish targets. I'll take up one more query, which was by a student. Yes, Anushka is saying LRR and DVT, especially for weak subjects. Absolutely, yes. They give you good width and depth. So LRR and DVT together are very good resources, but you should also be practicing MCQs in the form of tests, because that is how the final paper is going to be. So you should give various types of tests, and those tests, I will talk about it. There was a query about tests available in test series. I will address that as well.
I'll take one query before Dr. Deepti takes the test query. एक बच्चा पूछ रहा है कि सर anatomy मेरे को पढ़ने में रिपेलिंग लगता है, क्या करूं? So सोच के अगर तुझे पढ़ने में रिपेलिंग लगता है तो पूरी जिंदगी तो नहीं करना चाहते ना. That should be the motivation. I think I've heard this motivation in many of the classes when the preclinical teachers or paraclinical teachers are teaching. Sometimes they say अगर तुझे भाई बायोकेमिस्ट्री नहीं पसंद आ रही तो सोच के इसलिए बायोकेमिस्ट्री पढ़ने की पूरी जिंदगी कभी ना करनी पड़ जाए. So it is how we have to motivate ourselves, and we need to tell कि बॉस कभी कभी कड़वी दवाई भी खानी पड़ती है. You may not like something, but if you don't want to, it's like if you want to cure your ranks and you need to, antibiotics भी खाते हैं हम लोग, दवाइयाँ भी खाते हैं. It's all about getting the right perspective. Don't be a kid कि ये मुझे पसंद है वही करूंगा, ये पसंद है ये नहीं करूंगा. ऐसा थोड़ी होता है. जो जीतने के लिए जरूरी है वो सब करेंगे.
Okay, then there is a query which again I think could be a query of a lot of students. Nitish is asking, not able to recall subjects that I've revised because I get confused between options. So it's very important. If you are getting confused between options, there could be two problems. One, maybe you do not know the depth of content. So when the content is asked deeply, you get confused. Second problem could be that maybe you're not able to apply your content, right? So if it is an application problem, TNDs are super, super helpful for you. If it is superficial content in that particular subject, you must go back to your notes, right? So especially go back to your LRR notes, try and see where or what points did you miss, and that will help to improve your accuracy level. Okay.
I think, with this, we have taken most of the queries, like, so let's summarize what we talked about today. So what we have talked about today is how to keep your focus in distracting scenarios and how to make sure that you manage your phone, you manage your table, how you manage your day, and how you manage the routine. Like, for example, I see most students who are preparing for 2026 NEET PG, they don't know what to do. And it is so surprising for me. Some of them will come and they are preparing for 2026. Say, sir, अभी से DVT से शुरू करूँ. Then I get to know, बॉस उसको यही नहीं पता कि रिवीजन में क्या करना है और पहले क्या करना है. और कई लोग उसको कुछ कुछ बेच के जा रहे हैं और वो फंसा पड़ा. You build a routine. Your morning 1 hour should be done with 50 MCQs from your DQB. Evening 5 hours should be theory, preferably ultimate live class or a back to basics lecture. If you have done them both before, then you can do a self-study with your notes that you've already made. After 10 o'clock, there should be 1 hour to review what you've done in the day. 3 tests should be done, 3 subject or class tests should be done in a month, 1 GT in a month. So rhythm. So if you understand what I'm trying to tell you is, if you build a routine, you will win. रैंडम एक्ट्स विल नॉट लीड टू सक्सेस. ऐसा बोलते हैं ना कि एक साल में कभी एक बार लॉटरी खरीद ली तो जीत जाए, ऐसा होगा नहीं कभी भी ना. रोज खरीदेगा प्रोबेबिलिटी बढ़ेगी. वैसे ही जैसे यू सी फ्रॉम द फिनटेक और इन्फ्लुएंसर्स आल्सो कि कभी एक आधी बार जाके शेयर मार्केट में पैसा लगा दिया तो पैसे नहीं बनाएगा, खराब ही होंगे. रिदम बनाएगा तो ही जीतेगा ना. सो दैट आइडिया इज अबाउट बिल्डिंग दैट रूटीन.
Okay, I'm going to take up the last query and then we'll wind up the session. And that is, Dr. Vivek is asked, MCQ practice for NEET PG from what section? So anyone who's appearing for the upcoming NEET PG, approximately 30-35 days are there, right? Yes, practicing in the form of tests is very important. Your test series, I've repeatedly told this, has 5 levels of testing. Okay, the first is your Transform 10x mini test. So there are various types of tests in that: image-based, clinical vignettes, classification-based, and other things, okay, which is only 20 MCQs per test. Then the second level is your class test, which is around 50 MCQs, right, which is telling you what are absolute must-knows from every subject. They come with video discussions as well to ensure that you're able to apply your content. The next level is SWTs. It is also subject, but the number of questions is bigger, which is 200. The difference between class test and SWT is class test is based on the current pattern, last 1 or 2 sessions, whereas SWTs will cover your 5 years of PYQ, sometimes maybe even more than that, right? Then there are your grand tests. Grand tests, we all know, are 300, mixed bag, very important. You have to give them. Okay, then there are mock tests. So we have separate columns from INICET mock. There are separate columns for NEET PG mock and FMG mock. You should be giving these mock papers. Okay, they are based on a mixture of current and previous year topics. Lastly, now we have also included PYPs in your test series, which are previous year papers. They were already available in the DQB in the subject-wise format, but now we have put it as an entire test as well. So you will have INICET entire test in one place, which is PYP. Similarly, FMG entire test, NEET PG entire set, both sets, right? So these are various tests that are available to you in the test series. Please give different types of tests because the idea is to find out where you lack. Once you find that out, you will go and revise it from your LRR or main notes if required.
And finally, what I will add a line here, from what Deepti has said already. This is the time to focus on your online test series from your DAMS app. Like a lot of people are saying, sir, question kahan se karu, question kahan se karu. This is the time to use the online test series from your DAMS app. उसमें इतने सारे टेस्ट हैं, क्लास टेस्ट है, SWT है, नीट पीजी के लिए टेस्ट है, FMG के लिए टेस्ट है, ग्रैंड टेस्ट है, मॉक टेस्ट है, नीट पीजी के, इनिसेट के, FMG के. So previous year papers भी टेस्ट की तरह हैं. So my suggestion will be, this is the time when you are looking at MCQ practice, try मतलब shift to tests. अब मौका आ गया कि जितने टेस्ट देते हैं इतने टेस्ट देते हैं कि एग्जाम तक आके टेस्ट की आदत ही पड़ जाए. I think that should be the idea.
I will just add one more thing here, that even if anybody can, now we have 1 month course, we have taken out a special subscription to be able to help you. So you have 1 month subscriptions where you can take test series from Deadly Combo, right? The 1 month subscription is also available in Back to Basics, also in Ultimate App Live, also in TND. Now सारे TND के बच्चे ध्यान से सुनो, you have actually 2 cycles to do. One is your current cycle जो आपने करा होगा. We have given you additional 1 more cycle of all 19 subjects, which means with every TND you actually get 2 TND papers which are different from each other and both come with video discussions. So you have lots to practice from, and these are the most predictive tests because they are made by the faculty, right? So they have a very nice way of revising entire subject, covering the most important points as well as the current pattern of exams. Okay.
I take a quick query. बच्चे कह रहे सर मैं फाइनल ईयर स्टूडेंट हूँ, मैं कैसे शुरू करूँ? सो बेटा फाइनल ईयर में अगर आप हैं ग्रुप, यू नीड टू आंसर 3 क्वेश्चंस. क्या मैं अभी शुरू कर रहा हूँ या मैंने पहले पढ़ना शुरू कर रखा है और मैंने सब कुछ अच्छे से किया हुआ है? I'll give you the benchmark. Students in Delhi and Mumbai most of the time in their 3rd year MBBS they finish all 19 subjects by the time they reach their final year. क्या आप कर चुके हो, नहीं करें या करें? अगर नहीं किए, this is the right time to start building on your theory first. Rather than randomly doing subjects, you should anchor it to a course. And the best course for you should be the ultimate live course on the DAMS app, where you have a daily live class. All 19 subjects are fully taught in a live manner. ऐसा नहीं कि उसके टुकड़े लाइव पढ़ा, पूरा लाइव पढ़ा रहे हैं। 6 से 7 महीने में पूरा सिलेबस खत्म होता है, फिर दोबारा रिपीट होता है. So you can join anytime, and in a period of 12 months, you should get around 2 cycles of revision. So what would happen is कि
हाँ,
अपन पढ़ भी रहे होंगे और discuss भी कर रहे होंगे.
एक
And
क्वेरी
those
जो
are the
मेरा
subjects you should be
answer
studying.
A query I want to answer here because students sometimes ask what is the difference between Ultimate App Live and Back to Basics? कुछ भी नहीं है. The only difference is that in Back to Basics, everything is like a pre-recorded lecture for you. So it is for students who are very motivated and they can do it by themselves. But for those who are not able to follow targets made by themselves, there is Ultimate App Live. The content is same. The only difference is in Back to Basics, you don't get those live classes, but everything else in Back to Basics you get. So whether it is your test series, whether it is your Q bank, whether it is your short revision resources, everything is included except the Ultimate App Live classes. So you have to see just where you fit best. Do you want to do it live with us? Do it in the Ultimate App Live every day, 5 p.m. You feel you can't come live for whatever XYZ reason, do it through the Back to Basics. Our content is the most revisable, most high yielding, concise, crisp content, which is good for both your professional exams, INICET, NEET PG, you name it, and we will crack it. Okay.
Even if you are like, suppose if I was in your place, even if I am wanting to study in a self-driven manner with Back to Basics, I would still take Ultimate Life because I am anyhow getting Back to Basics in Ultimate Life. Ultimate Life is a tier above it. It's a more premium course where every day a teacher is coming live. So,
Yeah.
you whenever you need a teacher to help you with, you just have an option. You just need to put the button on and start listening to the teacher live and start asking your doubts, interacting. It gives you a lot of teacher time with you, a live teacher time with you. A lot means 5 hours every day actually is a lot of time that you have with the teacher.
Yeah. Chalo. So I think on that note, we will wish you a happy day today. And don't worry, try and use the methods which we have talked today about how to focus amidst the distractions. Do let us know if you find our suggestions effective. They have come from real life cases. A lot of these things that we've told you today, we are practicing in our daily life, right? Either with our own selves or with students, because we are attached to multiple students, right? So I'm sure some of the other hacks will definitely work for you. Okay.
And we wish you all the best. Somebody saying sir क्या classes cancel हो जाएंगी in the near? Nothing boss. अगले हफ्ते से क्लासेस सब शॉप पे शुरू हुए हैं. एक ही हफ्ते का प्रिकॉशन लिया था हमने just because a lot
Yes.
of teachers were traveling in the airports and we wanted to avoid the
Yeah, because
airport
the
traffic.
airports were closed down, a lot of them, and there were a lot of flight cancellations, right?
Ceasefire is already announced yesterday. I'm sure you're all following the news. So we wish you all the best. Have a great day ahead. Happy learning.
Take care, everyone. Have a great day.